Hello everyone. Let's talk a little bit about communication. Why communication is so important and why communication should be different from one person to another. It's common and direct knowledge that we cannot talk to everyone in the same way, especially when it comes to different ages. We'd be more comfortable and less formal with people around our age or younger. But when it comes to talking to people of elderly age, there needs to be a lot more respect and formality. When it comes to health-related appointments and services, the older you get, the more the demand of these services increase, which is no different when it comes to dental health. Many elderly struggle with hearing, reading, writing, and general communication due to the effects of aging. We'll be discussing how to properly communicate with this age group in order to achieve the best results possible. People of older age require more time to receive all the information. Do not try to rush. Due to their lack of focus and poor communication, you will have to be patient. Give them more time to ask their questions as well. Elderly care a lot more about their health than younger people would, so they tend to ask more questions related to it. Let them take their time and answer all their questions clearly. Due to some elderly having worse vision and hearing, reading your lips will help them receive the information correctly. This shows them you consider their health important. Due to some elderly struggling with hearing, you have to speak in a manner they can receive ideas in, slow and clear so they can understand you, and loud so they can hear you but do not shout. Eye contact is the most powerful form of nonverbal communication. It shows the patient's trust and interest. The result is a positive and comfortable atmosphere where the patient can feel safe and cared for. Giving the patient too much information at once may cause confusion. Instead of providing a long, detailed explanation, try using outline forms. Explaining things in steps will prove much easier to understand than things explained in bulk. Patients need to feel that their time and health are valued by their healthcare provider. Do not let people walk in and interrupt you during the session with a patient. Seeing what you're discussing will help the patients better understand their situation and condition. And if you could give them those pictures, they can use them later on as a reference. Try keeping medical terms to a minimal level. Use simple words to deliver your ideas and suggestions to them. Use familiar terms that the patient can understand with ease, and keep the information as simple as possible. Do not write down any complicated instructions. Make them as simple as possible and in a way anyone can follow without a problem. Give them a copy of those instructions so they can refer to it in the future. Elderly have a tendency of sticking to their beliefs and ideas. Do not argue with them even if you disagree. Instead, try to have a relaxed conversation and show them proof of why they should do what you're suggesting.
So, here is some tips about how to communicate with elderly during a dental visit at a dental setting. First of all, we need to schedule the patients earlier in the day. Elderly people, they tend to be tired at the end of the day, and they usually they need more time to communicate with a dental hygienist or with a dentist. So schedule them early in the day will allow them to have enough time. Usually dental offices, they get busier at the end of the day, so it's better to schedule a patient early in the morning. So once you have given the clients enough time during a dental visit, allow the clients to express their thoughts by asking questions and see if they have any concern for better understanding, if they have understand the educational points you gave them. So if you have any concern that they did not really understand what you're trying to educate them, have one of the staff members to call in about 24 hours, in the next 24 hours, to review your educational points. It's important to summarize the important points during a dental visit and allow the elderly to understand and discuss with them the most important points, and allow them to repeat what you have say. Let's say if you said brushing your teeth, it's very important twice a day, in the morning and in the night, and give them a chance to repeat what you have been saying to them, so that will lead to have a greater recall.
One of the most important steps during communication with an elderly at a dental office is when elder clients arrive at the dental office. The first thing we have to do is how to greet them. All the staff members have to greet the clients warmly and nicely, so the elder patients will feel so special and comfortable at the dental setting. Next step is to seat the elderly client in a very comfortable, quiet room for a better communication. It is very important to make things easy to read, such as using a large, easy-to-read print on all of your business cards, appointment cards, brochures, and educational materials. And also use an easy-to-read signs posted throughout the practice can be also helpful to provide important information for the client. And there is so many factors can make things better for a better communication, such as lighting in the examination room. Lighting will help the patient's ability to read printed materials, see facial expressions, and help the elderly client to read the lips. Keep the patient relaxed and focused is one of the keys to obtain a reliable information from the patient. By a light touch on the patient's shoulder, arm, or hand will help them relax and increase their level of trust. And also you can call the patients by their name, like Mrs. or Mr., so the visit seems to be more personal and important for a better communication. So communication is not an exact science. You will need to experiment and find which strategies work best for you and your staff. You will also need to remember that different patient has a different communication needs, which may require a different technique. However, you can start with the tips for a better communication, and after that you will find an increased level of comfort and satisfaction among your elderly patients, and you will be better able to care for this growing population. Thank you.